Disorders of immunoglobulin synthesis. Introduction to immunoglobulins. Immunoglobulins, Ig antibodies produced by B cells. Key role, immune defense against pathogens. Classes of immunoglobulins, IgA, IgD, IgA, IgG, IgM. Normal immunoglobulin synthesis process of production. B cells produce immunoglobulins. Gene rearrangement, VDJ recombination, role of T helper cells, facilitate class switching. Types of immunoglobulin disorders. Primary immunodeficiencies, common variable immunodeficiency, CVID, X-linked agammaglobulinemia, XLA, secondary immunodeficiencies, HIV/AIDS. Immunosuppressive therapy. Hypergammaglobulinemia, chronic infections. Autoimmune diseases. Paraproteinemias, multiple myeloma. Waldenstrom's macroglobulinemia. Common variable immunodeficiency, CVID, overview. Primary immunodeficiency with low serum immunoglobulins. Pathophysiology, impaired B-cell differentiation. Defective antibody production. Clinical features, recurrent infections. Autoimmune manifestations. Increased risk of malignancy. X-linked agammaglobulinemia, XLA, overview, genetic disorder with arrested B-cell development. Pathophysiology, mutation in the BTK gene. Lack of mature B cells and absence of Ig. Clinical features, severe bacterial infections. Onset in infancy. Hyper-IgM syndrome overview, characterized by normal or elevated IgM levels with low IgG, IgA, and Ig. Pathophysiology, defects in class switching. Mutations in CD40 ligand gene. Clinical features, recurrent infections. Neutropenia. Liver disease. Multiple myeloma overview, cancer of plasma cells with excessive production of abnormal Ig, paraprotein. Pathophysiology, clonal proliferation of malignant plasma cells in bone marrow. Clinical features, bone pain. Anemia. Renal dysfunction. Hypercalcemia. Diagnosis of immunoglobulin disorders. Laboratory tests, serum immunoglobulin levels, IgG, IgA, IgM, specific antibody titers. Genetic testing, identification of mutations, e.g., BTK gene for XLA, flow cytometry, analysis of B and T cell populations. Treatment approaches. Immunoglobulin replacement therapy for CVID and XLA. Antibiotic prophylaxis to prevent infections in immunocompromised patients. Targeted therapies, multiple myeloma, e.g., proteasome inhibitors, monoclonal antibodies, bone marrow transplant, considered in severe cases. Conclusion. In summary, disorders of immunoglobulin synthesis encompass a diverse range of conditions that significantly impact the immune system's ability to defend the body against infections. These disorders can arise from genetic defects, as seen in primary immunodeficiencies like X-linked agammaglobulinemia, or can be acquired, such as in cases of HIV, AIDS, or multiple myeloma. Early diagnosis through comprehensive laboratory testing and genetic analysis is crucial for effective management. Thank you.